COVID-19 update, measures being taken by the government, Minister of Sports gives announcements.
This is Flipping Grand Bahama News for week ending March 27th, 2020. I am Yasmin Popescu with these and more. Stay tuned. In the latest report from the Ministry of Health, our number of cases is now up to 9 persons confirmed infected. During a press conference last evening, the Minister, Dr. the Honorable Dwayne Sands, made the announcement.
As of Thursday, the 26th of March, the Ministry of Health has confirmed 9 cases of the virus in the Bahamas. The first 4 previously announced cases are in New Providence. The 5th case is in Grand Bahama and had no significant travel history. The most recently confirmed 4 cases are in New Providence. Only 1 had recent travel history, and that case had traveled to the Dominican Republic on the 13th of March. All of the most recently confirmed 4 cases are in home isolation, and they are being closely monitored by healthcare professionals. They do not require hospitalization at this time.
Minister Sands then gave information on the number of equipment we have for the hospitals.
At this time, 175 people have been tested in the Bahamas for COVID-19, following agreed international protocols. To date, we have some 2,300 testing kits on the island. More than 60 ventilators are here, and more are on the way to increase our current capacity. Thousands of PPE kits have been ordered to boost the supplies that we already have in stock. 3,000 additional are expected on the ground on Monday, and a further 4,000 will be here by the end of next week.
He insisted that everyone follow the necessary protocols to prevent getting the disease.
There is currently no vaccine for COVID-19. So the best way to prevent illness is to avoid being exposed to the virus. COVID-19 is primarily spread between people who are in close contact with each other through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the eyes, mouth, or nose of others. They can also land on nearby surfaces. When you touch these surfaces and put your hands in your eyes, mouth, or nose, you can infect yourself. So hand hygiene is crucial to success in the fight against coronavirus. We urge you to wash your hands frequently and thoroughly. Washing your hands with soap and water or using alcohol-based sanitizer kills viruses that may be on your hands. I am sure that you know that the coronavirus seems to have an oily coating on its surface. And I'm sure that you know that soap and alcohol are very effective in dissolving this greasy liquid coating. The actual scrubbing physically inactivates the virus, so it can't attach to and enter human cells. The water and scrubbing with your hands create more soap bubbles, which disrupt the chemical bonds that allow the virus to stick to surfaces. So you want to scrub, build up bubbles, and scrub some more, getting into every crack and crevice of your hands and fingers, including under your fingernails, for at least 20 seconds. Cold water works best, but warm water with soap works even better. Cold water works well, but warm water with soap works even better because it makes a better lather and more bubbles. Alcohol-based hand sanitizers are effective too if they are used properly. They need to have at least 60% alcohol in them, and you must use enough all over the surface of your hands. Rub it all over your hands and between your fingers until it dries completely. Alcohol also helps break up the membrane of the virus and kills it. But you need to make sure it gets into direct contact with the virus. While hand hygiene is critical, it is equally critical that you avoid touching your face, especially your eyes, nose, and mouth. Once contaminated, your hands can transfer the virus into your body through contact with the eyes, nose, or mouth. Additionally, make sure you and the people around you practice good respiratory hygiene at all times. This means covering your mouth and nose with your bent elbow or a tissue when you cough or sneeze. Then, dispose of the used tissue immediately and wash your hands. If you have mild cold or flu-like symptoms, stay at home. We do not want medical healthcare facilities filled with people who do not need urgent treatment. Call your medical health professional or our COVID-19 hotline if you need advice. You can call the 24-hour hotline at 502-7382 or 376-9350 from 8 a.m. to 8 p.m. and 376-9387 from 8 p.m. to 8 a.m. and toll-free 242-300-2619. The call center is reserved for COVID-19 related questions only. If your symptoms escalate and you think you need medical care, please call ahead first. If you have a medical emergency, call 911. A major part of our prevention strategy is physical distancing. By limiting the number of people you are in contact with, you lessen the chance of being infected, and we reduce the spread of the virus.
Countries around the world have taken the drastic step of closing borders as the number of affected persons and death rates soar.
This morning, the number of persons affected by the COVID-19 worldwide was 552,639, of which 25,044 have died and 397,021 are actively in treatment. And yet, the good news is 128,706 have recovered. Just late this week, the number of cases in U.S. have soared over those in China. And this morning, USA had recorded 87,755 infected, of which 1,304 had died. In China, although they had another 55 infected recently, their number of infected cases was 81,340. But China leads in deaths compared to the two with 3,292. However, the death toll is greatest so far for Italy, which had 8,215 and is third in the amount of persons infected with 80,589. The question of reinfection is still up in the air, with few cases from China finding that people who had the virus have contracted it again. But for the majority, there's very little reinfection. A treatment has been worked out in Cuba, which has been taken to Italy along with doctors this week, and we await the results.
In the latest from the World Health Organization, Director General Dr. Tedros gave a 6-point plan to all countries to use to halt and stop coronavirus.
Practicing social distancing, members of the World Health Organization gave their views from separate areas, and in his address, Dr. Tedros said,
a 6-point action plan for how to prepare and respond to this emergency. First, the public must be effectively prepared for the critical measures that are needed to help suppress the spread and protect vulnerable groups like the elderly and those with underlying health conditions. Second, ramp up surveillance and lab testing so that those with the virus can be identified quickly and isolated safely, helping to break the chain of transmission. Third, prioritize treatment for those at the highest risk of severe illness. And fourth, slow, suppress, and stop transmission to reduce the burden on healthcare facilities. This means safe hand washing, testing, isolating cases, and contact tracing, encouraging community-level physical distancing, and suspension of mass gatherings and international travel. For many on our planet, following even this basic advice is a struggle, but we as a global community must strive to make it possible. Fifth, we're building the ship as we sail, and it's critical that we continue to share learnings and innovations so that we can improve surveillance, prevention, and treatment, and ensure equitable access for the poorest to all research and development breakthroughs. And finally, we need to protect the health and humanitarian supply chain so that our frontline workers are protected and able to travel freely as they give life-saving care. Our message to all countries is clear. Heed this warning now. Back this plan politically and financially today, and we can save lives and slow the spread of this pandemic.
Here in the Bahamas last Thursday, the Prime Minister called for a curfew in the country of 9 p.m. as of Friday, March 20th. Then on Sunday, we got notice of 24-hour shutdown during a press conference held by the Minister of Health. On Tuesday, the Minister of Health held another press conference during which we learned of the first case in Grand Bahama from the Minister of State for Grand Bahama, Senator the Honorable Kwesi Thompson.
For the most part, that I've observed, persons in Grand Bahama are abiding by the first order that was put into place. Obviously, the second order was just put into place. We've been advised again by the Royal Bahamas Police Force, who's been out and have been assessing the situation in Grand Bahama, that persons have been complying. However, the important point to emphasize is that we want persons to stay home. Unless it is absolutely necessary and only in the circumstances that the order speaks to, we want persons to stay home. And I think that point has to be emphasized, and that is whether you are in Grand Bahama, whether you are in Nassau, whether you are in any family island, the point is we want you to stay home.
Also on Tuesday, the minister responsible for disaster management, Aram Lewis, was on hand to view the setting up of the quarantine units, which he thanked the power company for powering up. Taking a look at where we are financially, as we've heard already, help is on the way for persons in the tourism business who are affected by the shutdown. And as persons with loans, the central bank had something to say. In a press statement issued this week, the Central Bank of the Bahamas said it has arranged with domestic banks and credit unions to provide a 3-month deferral against repayment on credit facilities for businesses and households that are negatively impacted by the COVID-19 pandemic. This accommodation will be revisited in June 2020 for appropriate changes that may still be warranted, the release continued to say. Further, forbearance will be provided for borrowers who maintain their accounts in a good standing before the onset of the pandemic. It is on the condition that such payments will resume with accrued interest when the financial circumstances of each borrower recover. Some financial institutions have already announced credit support that could extend beyond 3 months. Although the administrative approach to implementing these and other accommodation will vary across lending institutions, the central bank will extend tolerant regulatory treatment to exclude those credit balances from being classified as arrears for restructured loans. Social assistance and relief payments deposited into bank accounts will remain available to satisfy the assistance needs of borrowers
and not to defray to debit service obligations. Borrowers should be advised that since this credit on which repayment has been postponed will continue to accrue interest, they should only take advantage of payment deferrals when other options of adjustments do not exist. Borrowers who can afford to do so are encouraged to continue making loan payments rather than see their loans increase through accrued interest. In all instances, borrowers are urged to inform their lending institutions of hardships they may be experiencing from loss or reduction in cash flow, income, or employment. More details on the payment of deferral will be released in the coming days.
We're taking a break, and when we return, more on what's going on in Grand Bahama. Welcome back. With everything moving rather rapidly around the world and at home, at the close of his speech on Sunday, the Prime Minister called for a day of prayer on Wednesday.
On Wednesday of this week, the nation was called to prayer by the Prime Minister for the nation, especially at this time. On that day, chaplain for the House of Assembly, Pastor Mario Moxie, and the Bahamas Christian Council led a video presentation featuring various pastors praying for the nation.
This land is our land. Together, we can call on our God to help us through these uncertain times.
Oh, so I'm singing.
The Lord be with you. Let us pray.
My brothers and sisters, blessings.
This is praying time.
All the things that people of faith do, the most unique is prayer.
We pray because in times like these, we recognize that we need someone greater than ourselves.
As we face this global pandemic that has now hit the shores of our nation, we must be reminded that the enemy's attack against the church has never changed, against the people of God has never changed.
In the midst of this present dilemma, let's not forget that our brothers and sisters in Grand Bahama and across Abaco are still trying to find their grip from the devastation of Hurricane Dorian.
3 months ago, our world was introduced to the coronavirus. Today, it has invaded the world, and we are people who are in need of God's help.
At this time, we're going to look to our God. We're going to look to our help, and we're going to look to God for our land.
Grace and peace from God our Father and the Lord Jesus Christ.
We are living in increasingly challenging times. It seems that before we can recover from one thing, here comes something else.
Thank you for joining us for this very special broadcast. It is the hope and prayer of the Bahamas Christian Council that our nation draws closer to God during this time.
In Grand Bahama, the Port Authority and the Chamber of Commerce has shown their civil duties by closing during the shutdown, following which the port sent out a video on staying safe.
We want to let the public know that we've complied with the government mandate to shut down our non-essential services, but our essential service work around the city, it continues. Now, we've closed our offices to the public to ensure that we're doing things like social distancing and that we're safeguarding our employees and the public. But the work that we need to do to make sure that the city maintains, that continues. Collections and debris removals continues. Our inspection work around those that have remediated their homes since Hurricane Dorian, that continues. Our work around potable water returning in May, that work continues, and we remain committed to ensuring that we do so as safely and as quickly as we possibly can.
We continue to work with the Department of Environmental Health Services, our NGO partners, as well as local and international stakeholders, to take the necessary precautions to ensure the safety and health of all our residents. To that extent, we've enhanced the protocols around water distribution sites to mitigate the risk of COVID-19 spreading. These updates, in line with the Ministry of Health's recommendations, include additional hygiene protocols, implementation of social distancing, increasing the role of monitors to reduce direct contact with the taps, as well as updating our advisory to the public to stay home if you're presenting any symptoms of illness and to please have someone else retrieve your water for you. We've taken these steps to ensure that the distribution of water for drinking continues, whilst mitigating the risk to the general public, the NGOs, the local volunteers, and to our employees. The message we want to be extremely clear about is this: our water distribution sites will continue to stay open throughout this challenging time.
The focus of the crisis management team here at GBPA has been contingency planning. This means we remain optimistic about our outcomes, but must plan for lesser scenarios. To that aim, we've accelerated our annual hurricane relief program to purchase trailers of food to be shipped here in Grand Bahama. In the event that those in need increase in numbers, we've taken these steps to ensure we can help meet some of those needs. I would like to stress that there are currently no food shortages on island, and there is no need to panic buy food. This measure should not cause concern. We are simply preparing for unlikely worst-case scenarios and accelerating our existing hurricane relief strategy in preparation for this year's hurricane season, which is now only 3 months away.
We are fully aware that there are foreseeable and unforeseeable consequences that come when we are challenged with events of this scale. We are learning from the mistakes of other countries and sharing critical information with residents to help prevent the spread of this pandemic. Our task force has reviewed the potential impact, and we are taking the following steps to assist with the private, public, and industrial sector initiatives. We have ensured that there will be no disconnects for water utility customers. We have worked with the Grand Bahama Power Company to have the storm recovery and stabilization charge suspended until further notice. As it relates to our licensees, we fully understand the challenges that you are facing. For that reason, during the time that the emergency order exists, we will suspend collection of license fees for the impacted sectors.
It's hard for us all to come to terms with this new global pandemic of the coronavirus so soon on the heels of Hurricane Dorian, whose effects we still haven't recovered from. And like a hurricane, this is a time of uncertainty, precaution, and prayer. I'd like to commend the Bahamas government and the Prime Minister for his leadership and for the mammoth exercise they're undertaking in controlling and containing the spread of this COVID-19 virus to our shores. This includes measures the government are putting in place to test and treat any cases which require hospitalization and also isolation units where necessary. We are very cognizant that the sole governing body for hospitals, health facilities and medical services in Grand Bahama resides with the Government of the Bahamas, the Ministry of Health, the Public Hospital Authority and locally the Grand Bahama Health Services. But as the Prime Minister stated, this requires all hands on deck, and the Grand Bahama Port Authority will be as fully supportive as we can possibly be. In that vein, we're working with the government, the Grand Bahama Health Services, Dr. Bartlett and his team, together with the Minister of Grand Bahama. To date, I'm happy to report the following. We have instigated measures described by our GBPA team before me to ensure clean, sanitised, uninterrupted supply of fresh, potable water. We're doing this in part by implementing new protocols around potable water distribution sites, and those distribution sites will remain free of charge. We will ensure abundant tap water, essential to the extra high level of hygiene and washing required during this time of COVID. In addition to this, the GBPA are working hand in hand with the health services and the government of the Bahamas to put an extra medical facility on standby and at the immediate disposal of the Grand Bahama Health Services, should the need arise and should the hospital authority need more beds. You will hear more details from the health services on this later this week. Further, the Grand Bahama Port Authority with the industrial sector, specifically the companies previously mentioned, are amassing a pool of additional funds and resources to contribute to the health authority as regards sourcing, procurement and shipping of specialised medical equipment to Grand Bahama in order to assist the Grand Bahama Health Services with the fight against COVID-19, again, should the need arise for more hospital beds in Grand Bahama. We encourage all our residents, please, to adhere to precautionary measures and to keep yourselves informed on this virus using credible sources like the government and our COVID-19 website. For our part, we will continue to share all such messages on our platforms too, and we ask that you stay safe, and may God continue to keep you and your families and bless our medical corps. Thank you.
The Grand Bahama Chamber of Commerce also issued to all its members the Emergency Powers Order 2020.
In the Emergency Powers COVID-19 No. 2 Order 2020, it was noted that there would be a 24-hour curfew March 24th to March 31st, 2020. As many as can, employers are being asked to allow some staff to work from home. In the public service, all are asked to work from home unless specifically designated as an essential worker. Everyone is asked to stay at home and remain inside unless they are an essential worker or work for an exempted business. Only reasons allowed to be on the streets are to go to the bank, pharmacy, grocery shopping, refueling, doctor's visit, or exercise. There are no restrictions on doctors' offices, hospitals and medical facilities, medical supply establishments, hotels, airports, or commercial courier flights. Banks are open 9 to 5. Pharmacies, gas stations, commercial ports and related businesses, laundromats and wash houses are open from 6 a.m. to 5 p.m. Wholesale, retail, grocery stores, and farmers market open from 6 a.m. to 7 p.m. And drive-through restaurants and takeaway food vendors open from 6 a.m. to 7:30 p.m. Restrictions on social activities include no private parties with anyone outside immediate household, no recreational or competitive sporting events, no weddings with more than 10 guests, no banquets, balls, or receptions, no social events, no funerals with more than 10 members of immediate family, no meeting of fraternal society, private or social club, or civic association or organization. All airports are closed to incoming international flights carrying any visitors without written permission. All seaports are closed, with an exception for outgoing flights and ships, cargo flights or cargo ships, commercial courier flights, emergency medical flights, emergency flight approved by Civil Aviation Authority. For domestic travel, Not permitted are mail boats sailing inter-island except for transport of freight, inter-island private commercial sea transport, commercial travel. Everyone is asked, especially in businesses, to practice social distancing of no less than 6 feet. A closure has been called for public beaches, fish fry and other occasional markets throughout the Bahamas, all docks including Potter's Key Dock. Those businesses exempted are the Bahamas Red Cross, Arawak Port Development, Freeport Container Port, Freeport Harbor Company, the Bridge Authority, Cloud Carib Limited, a business license to provide security guard services, a credit union, commercial bakery, only construction companies carrying on hurricane relief, reconstruction, and restoration efforts in the islands of Grand Bahama, Abaco, and their respective keys. Exempted workers include the Royal Bahamas Police Force, the Royal Bahamas Defense Force, Fire Services, the Department of Correctional Services, the National Insurance Board, the Department of Social Services, the Department of Environmental Health Services, the Customs Department, Waste Disposal and Sanitation Companies, hospital, health care or medical facility, essential officers of any water, electricity or other sector encompassing the provision of electronic communication, including print and electronic media. Fines for any person, company, or organization in breach of the order will face imprisonment, fine, or both, not exceeding 10,000 or 18 months in prison.
Following this, a resolution has been published to which calls for the continuance of the proclamation of emergency until the 30th day of April 2020, being a period of 30 days from the date on which it would otherwise have expired. Prior to the shutdown, the Bahamas Ministry of Tourism and Aviation partnered with the Public Hospitals Authority to present a health seminar on novel coronavirus to taxi drivers and local vendors. The session was held at the Freeport Harbor and was coordinated to share accurate information regarding the virus and provide general safety precautions to take amid growing concerns.
Dr. Frank Bartlett, head of the Grand Bahama Coronavirus Task Force, was quoted saying, "It's important to remember that coronavirus is not necessarily a death sentence. As much as 80% of the persons who have had infection have no symptoms whatsoever, and 15% of the cases end up in hospital." He went on to say that the elderly and individuals with serious chronic illnesses have accounted for most of the recorded COVID-19 related deaths. However, he warned listeners not to take the pandemic too lightly. During his remarks, Bartlett provided background information on COVID-19, including its genetic makeup, origin, symptoms, and how the virus is spread. He advised the tourism practitioners not to panic and instead recommended a few everyday safety measures to practice.
We'll be right back with national, regional, and sporting news.
The Ministry of Health is working to ensure the safety of the Bahamian people. Help us minimize the risk that coronavirus poses to citizens, residents, and visitors by following these 5 easy steps. Step 1. Wet your hands with clean water. Apply soap and lather for 20 seconds by rubbing them together. Include the top of your hands between your fingers and under your fingernails. Rinse your hands under clean water, then dry them with a paper towel or air dry them. Remember to wash your hands before and after eating, preparing a meal, changing a diaper, or caring for the sick, and always after using the bathroom, touching money, shaking hands, or taking out the trash. Step 2. Cough and sneeze in your elbow or upper sleeve, not in your hands, not in the air. Or you can cover your nose and mouth with a tissue when you cough or sneeze. Put your used tissue in the trash bin when you are finished. Remember to wash your hands with soap and clean water after you cough or sneeze. Also, remember never to spit on the ground, roads, or in open spaces. Step 3. Ensure that raw meat is properly handled and cooked thoroughly. Step 4. Avoid sharing drinking glasses, eating utensils like spoons and forks, or sharing personal items such as toothbrushes and towels. Germs can live on surfaces we touch, so wipe and disinfect surfaces where germs can live, and keep your surroundings clean. Step 5. Avoid close contact with anyone showing symptoms of respiratory illness, such as coughing or sneezing. Should you or anyone you know feel that you have been exposed to the coronavirus, contact the surveillance unit of the Ministry of Health immediately. To reach us, call 502-4776, 502-4790, or 502-4737. We want Bahamians and those that live with and visit us to remain safe from the coronavirus. To do this, we need the help of each and every one of you to follow the simple steps we have shared. Let's stay safe, Bahamas.
Welcome back. In national news, most recently, IMS Bahamas' core team of highly trained and qualified marine pilots have been licensed by the Ministry of Transport and the Port Department to pilot vessels in the Greater Bimini area, providing first-hand expert advice on vessel maneuvering in and out of the ports in the Greater Bimini area. According to a release, Captain Kendall Williamson, IMS President, said, "Marine pilot services are of the utmost importance as it pertains to maritime safety and the economic development of a nation. Over 90% of global trade is conducted by sea. In addition to ensuring the safe navigation of our waters, the very nature of our work is to serve the Bahamian public, the government of the Bahamas, and the general shipping community in promoting sustained economic development. The COVID-19 pandemic is a clear example of how important the role of maritime pilot plays in the maritime industry. Even as many businesses have been ordered closed, ships are still being allowed to transport goods for our country's survival. Additionally, the company and its directors have taken on critical advocacy work meant to facilitate the continued growth of the sector and open doors for future generations of qualified maritime industrial professionals." In the region, the announced 2020 Economic Empowerment Conference set for March 27th and 28th in Turks and Caicos has been postponed. According to organizers in a release, "We have been following closely the worldwide and national developments with respect to the novel coronavirus COVID-19. We have also sought the advice of officials from the TCIG Ministry of Health and have taken note of all the advice, protocols, and precautionary measures being implemented and advocated by the Health Ministry officials, including reducing transmission by avoiding, where possible, large public gatherings. It's in this regard that we have taken the hard and difficult decision to postpone the 2020 Economic Empowerment Conference. In view of all the risk and potential impact posed by COVID-19 to our small island nation, it will be unwise for us to proceed with hosting of the conference as scheduled on March 27th and 28th, 2020. We have already contacted all of our sponsors, speakers, panelists, moderators, and registrants to advise them of this decision. We have the support and commitment of our sponsors, speakers, and panelists to bring to you the 2020 Economic Empowerment Conference at a later date when COVID-19 no longer poses such a disastrous effect to the personal and economic health of our islands. The theme of the 2020 Economic Empowerment Conference is Economic Power and Possibilities for Sustainable Growth and Development for the TCI Economy. Our agenda included important presentations and panel discussions surrounding evaluating the state of the TCI economy and proposing strategies to ensure a sustained, growing economy in which all can benefit. It's clear in view of the potential impact of COVID-19 that these discussions and conversations will be even more important once the impact from COVID-19 subsides. It is in that regard
that we will make a further announcement with respect to the new dates for the 2020 Economic Empowerment Conference at a later time. We wish to thank our sponsors, speakers, panelists, moderators, registrants, and the public for believing in the vision that is the 2020 Economic Empowerment Conference.
In sporting news, the Minister of Youth, Sports and Culture, Honorable Anisha Roll, issued a video this week on COVID-19.
Over the next few days, the ministry will electronically publish and share safe social distancing activities that lend themselves to continued social development, albeit in confined spaces. Departments under our remit will provide guidelines for small team-building activities, at-home games for youth and family, effective indoor and yard exercises, as well as activities for cultural engagement through quick and easy projects that promote artistic expression. These communications can be accessed via the ministry's webpage and Facebook media for your enjoyment. Remember that how well and how soon we defeat this pandemic depends on how all of us cooperate to protect each of us. On behalf of the Ministry of Youth, Sports and Culture, I thank every citizen, resident, and guest within the Commonwealth of the Bahamas for exercising patience, understanding, and cooperation during this period.
Weather present seems to be mocking the global pandemic. But let's have a look at the 7-day weather forecast. That's all for this week. For Flipping Grand Bahama News, I'm Yasmin Popescu. Looking forward to seeing you next week.